that's what we're here for. If you can go on to the next slide for me, please, Emma. To provide, as I said, updates on national strategic developments, to provide a space for the Head Start partnerships to share their key learning and insight, and enable learning and resources to be shared on a national stage. So please do, if you've got anything that you use, that you find really helpful, please do put it in the chat, and let everybody else know about it. That would be super. So in terms of housekeeping, we will be recording. In fact, recording has already started. Recording. So if you're uncomfortable about being recorded, then please do just stick things in the chat rather than speaking publicly, and that way you can stay off camera. We would in any case ask you to stay off camera while the main speakers are speaking. Just it makes it a bit of a cleaner visual experience, and please do use the chat function for questions. If you stick questions in the chat, we're looking for it to be a really interactive session with DFE and NHS England, so we'll then be able to call on you to input your questions. I will just pause for a second. We had a national event a couple of weeks ago, and Teams was a bit glitchy for people, and we had one poor woman who was trying to tell us that that she didn't have a workshop, and her chat wasn't working, and she couldn't raise her hand either. So if anybody is having any technical problems that will impact on their ability to input or take part in the afternoon, I'm just going to pause now and let you shout out, so that we know and you're not suffering in silence, and we can see if there's anything we can do about it.
Okay. Hello.
I'm not sure if that's a cry for help. Right, anybody got any glitches, or can I move on? I'm going to take that as a no glitches. If there are any issues, you should have all received 2 workshop invitations. If you haven't, or if you're not sure about anything to do with workshops, then please do email Tamara, and Tamara will, because obviously we'll be about to move off this slide, Tamara will also put her email into the chat, just so that you can, if you discover a problem later on that you didn't know you had, then you can email her at that point as well. And yes, please do share resources. We will be, as I mentioned, the reason we're recording this is we'll make the recording available publicly. So if you've got colleagues who wanted to come and couldn't make it, then do let them know that they'll be able to catch up with it at a later stage. And we will be sharing the slides as well, because I know that's a question people always ask. So you don't feel that you have to madly scribble down anything that is on a slide. So I think that was it for that particular slide. On to the next one for me, please. So that's what we're going to be doing this afternoon. I'm doing the first bit, which is the introduction. Then we have got Scott doing us an update from the National Lottery Community Fund. Then we have Daniela Durso and David Lockwood doing an update from government. And then we've got your workshops. So you should have an invitation to workshop 1 for 2:20, and then workshop 2 at 3 o'clock. And we are being uncharacteristically generous with our breaks today. So you have a whole 10 minutes in between the 2 workshops. So hopefully that gives you a chance to get a cup of tea, maybe even a biscuit, and gather your thoughts before workshop 2. On to the next slide, please, Emma. So I will just talk a little bit, but I might just get Pam and Donna to introduce themselves, so that that you know who it is that I'm talking about, because I really don't do any of the actual work. I just turn up and do stuff like this. So the actual work for the NCB mental health and wellbeing team is done by Pam and Donna. So Pam and Donna, do you want to introduce yourselves?
Thanks, Amanda. I'm Pam Shaw. I'm the National Children's Bureau lead on children and young people's mental health and wellbeing. So I look after our programme work, which includes Head Start and the Schools Wellbeing Partnership, amongst other things.
Thank you. I'm Donna Darby, Senior Programmes Officer, and I've been working with the 6 Head Start partnerships around their sustainability planning and dissemination of learning as part of NCB's mental health and wellbeing team.
Thanks, Donna. And a newer arrival to the team, but no less important, Deb, do you want to introduce yourself?
Thanks, Amanda. I'm Deb McLean-Thorne, and I'm also Senior Programmes Officer in the Mental Health and Wellbeing team. And I've been working alongside Pam and Donna, particularly around Head Start Whole, cost-benefit analysis, and be doing some future work with 2 of the other partnerships soon.
Super. And one of the things that I sort of should have described earlier was that the work that we do with the Head Start partnerships. So our role in Head Start is to gather and disseminate learning, as well as providing support to the partnerships especially around their thinking on sustainability and evaluation. What we're really trying to do is make sure that they've got the evidence that they need to make the argument for continued funding when the lottery funding comes to an end in 6 months' time. So is it 6 months' time? Have I got that right, Donna?
It'll be in summer next year, so
summer
just a bit longer than 6 months. Yeah.
So just under a year's time. So so some really great work going on, but obviously we know that especially where you're doing preventative work, sometimes it can be really difficult to make the argument and demonstrate demonstrate in a really sort of coherent way why it's needed and the good that it does. So that's what we're really focusing on with the sites and trying to support them with. This is the last theme networking event that we're doing, bringing together the learning from the Head Start partnerships, and it is such a privilege to have been working with the sites and to be able to share the amazing stuff that they have been doing. So we're really delighted to be able to do that with you this afternoon. If you want to sort of know any more about either the team and what the team does, because it's not just about Head Start, we also run the Schools Wellbeing Partnership, then there are some links up there on the slide which you won't be able to click on, but maybe somebody could put those in the chat as well, just in case anybody wants to have a quick look at those. But obviously the slides will come to you, so you can do that then. Now, I think that's the end of everything that just a quick sort of a few more housekeeping things in terms of the workshops, I think. So when it comes to workshops, basically once we finish this plenary session, that's it. So you don't need to come back here, you can just leave the session and stop worrying about that, and then just join your workshops for the 2 different sessions. Hopefully that's clear enough. And each workshop will be staffed by a member of NCB staff, so any issues with any of the technical aspects of it, we will do our very best to help. Fingers crossed. I will give you my top teams tips just in case you haven't got them. I think most people know by now, but if the slides are a bit small at any point, especially if there's graphs or anything on them, then if you press Control and you scroll your mouse wheel up or down, you can make it bigger or smaller. And if you get in, and if the chat gets excitable and you can't read it because people's chat things are pinging in, if you go into your main team screen and into the chat there, you can press on the 3 little dots, you can mute it. So just sort of makes the experience a bit less frantic or frenetic. So hopefully we have got Scott Hignett here, who we can now move on to and give you a bit of an update from the Lottery Community Fund.
Hi everyone, thank you. I'll just try to upload the PowerPoint presentation that I've got for today. which will hopefully come through now. Can everyone see that on the screen now, starting off with Head Start? Is that coming on people's screens? Can you just give me a thumbs up? Brilliant, thank you. Yeah, so thank you, Amanda, and thank you for the wonderful introduction there. Yes, as Amanda said, my name's Scott Hignett, and I'm Head of Funding at the National Lottery Community Fund. Hopefully many of you will know the National Lottery Community Fund, or may have had funding from us in the past, or may be looking to apply to us in the future. For those of you who don't know, the National Lottery Community Fund is the largest funder of community activity in the UK. And we have a really clear ethos about what we do. And that's summed up around when people are in the lead, communities thrive. And from this ethos, we truly believe that people understand what's needed in their communities better than anyone. As a funder, we listen, collaborate and fund so that good things can happen. But these fundamentally good things couldn't happen without National Lottery players. So it's just on me as well to just say that's why we're proud to award the money raised by the National Lottery players across the UK. As this is a bit of an update, what I'll go on to is the ethos of the Head Start programme, where it began, where it sits within the fund's portfolio. But just as a very, very quick update on our structure within the National Lottery Community Fund. I don't know if you were aware yesterday, but yesterday we publicly announced our new Chief Executive, which is David Knott. So if you Google that, you'll find all the details there. And David Knott has absolutely reaffirmed our commitment to putting communities first. And through that, we now have a published document which sets out some of our key principles under our commitment to communities. So again, it falls back to that ethos around when people are in the lead, communities thrive, and we absolutely believe that. So I'll move on to the next slide, just to give you a little brief overview of where Head Start sits within the National Lottery Fund funding family. And effectively, Head Start sits within what we call our strategic programmes interventions. So as the slide says, over 490 million invested in England over the last 10 years through these particular programmes. And they cover basically from birth through to later life. So we have a Better Start, Head Start, which we're here to talk about today, Talent Match, our youth unemployment programme, multiple complex needs and ageing better. Absolutely at the core of this is delivered through cross-sector partnerships, and fundamental to all of these has been able to give a test and learn to innovative approaches tackling some of the most serious social issues people are facing throughout their lifetimes. All the programmes and partnerships have co-production and test and learn at their core, and this is the principle that underpins our focus of achieving system change and lasting impact beyond our long-term funding. It's around the test and learn and the co-production that we're going to focus. I will focus on it a little bit more today, but also we have our 6 wonderful partnerships, 6 local authority-led partnerships here today. And I can only really encourage you to listen to their sessions a little later today. We provide the funding, but it's those who absolutely do the hard work in getting what's delivered to the young people who are need the most. So let's have a look at slide 2, which is, sorry, slide 4, yeah. So all of this is, so I think my slides jumping all around the place, sorry. Yeah, so a Head Start overview. So Head Start was developed through the listening process, listening to communities and listening to young people for absolutely what they wanted. And it's through this listening that the Head Start programme developed. So Head Start is a 6-year, near 68 million programme that supports young people aged between 10 and 16 who are at risk of developing mental health conditions. And for those who don't know, the Head Start programme was originally a 5-year programme and should have finished in the summer of this year. But the National Community Fund absolutely acknowledged the impact the pandemic was going to have on the mental health and well-being of young people, and continues to have. So we were able to extend the programme with a further near £9 million of funding for another year. And this has given the opportunity for our 6 partnerships to really start to help and embed the learning that's taken place. Excuse me, sorry, that's always going to happen. So it's led through 6 local authority partnerships who collectively and collaboratively work with young people, parents, schools, community organisations and other services to build people's emotional resilience from an early age and have a positive impact on their future. So far, Head Start has worked with over 430 schools and worked with over 250,000 young people. So quite a significant investment to what we do. So through Head Start, what do we hope to achieve? Well, we hope to achieve through this ambitious programme 3 original programme aims. So the first one was to improvement of mental health and well-being of at-risk young people. Head Start aims to improve engagement in school and improved academic achievement. And Head Start also aims to reduce engagement in risky behaviour. All of this and all of what we do and what we try to do is underpinned by this wonderful thing called Proportionate Universalism. And it's from our young people in Head Start who basically put this into simple language that I can understand and hopefully a lot of others can understand, which is effectively says that everybody gets something, but some get more than others. And this is the absolute principle of our funding, where we're trying to demonstrate an impact and target our funding at the young people who need it the most. So the proportionate universalism, everyone gets something, but some get more than others, is the absolute driver for this programme. So the principles of test and learn. So the Head Start programme is based on the notion of test and learn. And for the early years of the programme delivery, this allowed our 6 partnerships to explore and be creative in their solutions to helping young people improve their mental health and well-being. For the remainder of the programme, for about the last 18 months, the partnerships have switched their focus to more of a test and embed model, so we can ensure that the important learning and interventions from the programme are adapted and adopted more widely. The principles of our strategic programmes was never to leave a financial legacy behind, but more of a learning legacy where appropriate people, organisations can make decisions based on what our multi-million-pound investments have helped to create. And it's through our programme evaluation consortium led by the Anna Freud Centre for Children, in combination with our own learning from within the National Lottery Community Fund, that important information and principles are starting to emerge on how best to improve the mental health and well-being of young people. Across around the point around, which was put together very beautifully by our Head Start Kent young people, about everyone gets something, but some get more than others. And that absolutely underpins the principle of what we try to do with the National Lottery funding, is in that we target it to have the biggest impact possible. But by doing that, we have to accept that some will get more than others, but proportionately they get what they need. And I think that will echo across all of young people's intervention for mental health and well-being, is that some are in a more difficult place than others. And therefore, instead of just doing an absolute pan approach to everyone, we take a more targeted approach, if you like, and the universal and targeted. So that's that bit there for us. So if we move on to the next slide, which I hope will be slide 5. Brilliant. Yes. OK. So as I said, the principles of test and learn. Yeah. So the Head Start programme was based on the notion of test and learn. And for the very beginning of the programme, this allowed our partnerships to explore and be creative in their solutions to helping young people improve their mental health and well-being. And this was a key shift when we made the strategic programmes, because previously funding would have been to absolute outcomes where we would have been more defined on what we wanted you to achieve. But because through the strategic programmes we wanted to shift the dial, was the phrase of the day, on some of the more entrenched and stubborn problems within England, then we allowed this test and learn phase to begin with. And we were happy to do that so others didn't have to have those failings before they knew what worked. For the last 18 months of the programme, the partnerships switched their focus to a test and embed model, so we could ensure that the important learning interventions from the programme were able to be adapted and adopted more widely. So it wasn't about leaving a financial legacy or a financial burden even from the strategic programmes. It was all about leaving a learning legacy which others can hopefully learn from. And this is the bit where, as I said, hopefully before, was around the National Lottery Community Fund provides the funding for this particular programme, but it's absolutely our 6 partnerships that are at the front of delivery where the most impact has happened, and especially over the last 12 to 18 months during the pandemic, their response has been absolutely phenomenal to the health, mental health, well-being of the young people within their partnerships. So as and when you get to their sessions later on today, I can only just really encourage you to ask those questions that you want to ask, and find out more, because those are the people where the knowledge lies. So leading on to the learning legacy of this, so we have a program evaluator who's led by the Anna Freud Centre for Children, in combination with our own learning that we found out from the National Community Fund. So some important principles are starting to emerge to how best to improve the mental health and well-being of young people. So it's some of these principles that I'd like to explore with you today. So the first one is around that new evidence shows that young people, particularly girls, are at an increased risk of mental health problems between the ages of 11 and 14. And this is much younger than was previously thought. The second key point is around genuine co-production. So genuine co-production is really difficult. It takes a lot of time, a lot of effort, a lot of pitfalls and a lot of heartache to get there. But it is absolutely vital in the development and continuation of these interventions. And then the last one is that young people with more complex, chaotic lives need a trusted place and a trusted person to truly engage in this programme and their lives in more general to thrive. So if we can move on to slide 7, please. Brilliant. So looking at the earlier onset of mental health problems. So the first one that we talked about is that young people, particularly girls, are an increased risk of mental health problems between the ages of 11 and 14. So an evidence briefing that has been produced by the Anna Freud Centre, University College London and other partners has found in particular that the emotional difficulties of girls escalate as they move from early to mid-adolescence. On average, their emotional difficulties increase 17% between the ages of 11 and 14. This is in contrast to boys who show fairly stable levels of difficulties, even decreasing slightly over time. Importantly, this is an age range for girls is younger than was previously thought. So interventions need to start before they reach secondary school. And as girls get older, their behavioural difficulties increase to almost the same level as boys. So the important bit here is the briefing evidence states these new findings act as a wake-up call not to wait until young people show signs of mental distress as older teenagers before interventions take place. The implications of this is the findings point to worrying trajectories for girls as they progress through adolescence. They also highlight the transition between primary and secondary school and the beginning of secondary school as important periods of opportunity for prevention and early intervention. Providing support and guidance at home or in school may prevent problems from escalating during this critical period. It's through the Head Start programme and, as I said before, more importantly, the 6 partnerships that we've been able to explore the appropriate interventions in this developing area of evidence. This ensures we continue to support the young people most in need and attempt to avoid the later in life scarring that untreated early mental health conditions can create. This gender difference is also explored further through findings from social finance entitled Invisible Girls, Why School Exclusions Are Not Gender Neutral. And moving on to slide 8, yeah, so co-production. The second area is around genuine co-production. As I said, this is something that the National Lottery Community Fund holds deep in its heart with our young people in the lead committee, and is embedded in, or we try to embed in everything that we do, because genuine co-production is difficult. So Head Start was developed through a proactive effort from the National Lottery Community Fund around 7 years ago to reach out to young people and establish not what was the matter with them, but more importantly, what matters to them. From this, the fund was given 2 clear messages: that we needed to address the issues of mental health in young people and address youth unemployment. From these messages, 2 of our 5 strategic programs are developed: Talent Match and Head Start, that we talk about today. These areas remain as important, in fact, they're probably more important than when the messages were first heard from young people those 7 years ago. And move on to slide 9, please. So the driving principles of co-production. So young people involved in co-production, for many, it's seen as a coping mechanism and a way to develop their own self-esteem and confidence. Co-production through Head Start has to be system-wide to not only include the young people, their parents or carers, but also the other areas or people that they interact with. We have found that genuine co-production needs to be underpinned by 3 driving principles. The first one, there has to be a transfer of power. They have to be able to do something that they couldn't do before. They have to be listened to and evidence that they've been heard. And there has to be co-production of outcomes relevant to all parties. If we can combine all of those 3 when we're doing co-production, then the outcomes will be significantly better. The level of co-production will chime with other similar key findings that we found around taking the whole system approach. The importance of a system-wide approach, to me, this is the biggest success of Head Start. Sorry, this will be the biggest success of Head Start, will be joining the system up around young people, from whole school approaches to linking into community support and improved collaboration across services, from schools to early help to health. There is a need to create a common language and a common approach across the system for talking about young people's emotional well-being, from how to have a resilience conversation to ensuring those working around young people in schools and the community have a shared understanding and training in trauma-informed approaches, such as those delivered in Cornwall. The key ingredients required for the whole school approach, the whole system approach, it's not just schools, but community and services all working together. Senior leadership buy-in to enable change at scale. Delegates will know all this, but the Head Start can demonstrate how it is working. We can have slide 10, please. Yeah, so the final area I'd like to talk about is this concept of trusted place and trusted person. So the other program that I look after is Talent Match, which is a youth unemployment program aged 16 to 21. And we found very similar things between Head Start and Talent Match in this notion of a trusted place and trusted person. So this final area is around the concept, as I say, of trusted place and trusted person, especially for those young people who lead complex and chaotic lives. So for young people with complex and chaotic lives, a trusted place coupled with a trusted person is often missing in their lives, significantly reducing their abilities to create an escape or outlet mechanism for their problems and issues. We've found through other young person interventions that a locally trusted organisation will have a greater impact on the success, as the young people have to have trusted connection with the place of intervention delivery, be that a specific location within the school or even away from school premises. When making these connections, the concept of a mentoring approach is shown to have a positive impact on the young people as they are able to create that trusted person status, creating stability, support and encouragement. Again, key factors that are often missing in young people's lives. We've also found, and I mentioned this previously, is around a PACE approach, which is the acronym for play, acceptance, curiosity and empathy. This is particularly important for many young people who've come from troubled pasts or continue to lead troubled lives, as the play element has often been missing in their early upbringings, and their ability to laugh and have fun is something that they don't readily understand. The acceptance of their current situation and why they've got there, instead of judging immediately, and curiosity to find out what led them to that place in their lives. And then the empathy to go ahead and look to do something to deal with it with a totally empathetic approach. So for me, to include Head Start continues to be a success, it's continued to have an impact, but it's always about the legacy of learning that is particularly important. So for me, it's through the normalisation, inspiration and determination that young people through the Head Start programme are being allowed to learn and develop techniques to not only improve their own mental health and well-being, but the mental health and well-being of the people who are closest to them. These collective successes would not be possible if there was not a belief in the Head Start programme and the difference it is making. Hope through the conference today you're able to evidence the difference the programme is making and the positive impact it is having on the lives of young people and those closest to them. So that's me. I don't know if anyone's got any questions. Thank you. Any questions? Yeah. And again, apologies for PowerPoint live, which I think the live bit got away with itself. But I have literally got to dip out for another conference, but I have got 10 or, well, however long we think is appropriate. But yeah, the next 5-10 minutes for any questions anyone might have.
Thank you so much, Scott, and don't apologise about the slides. I think that's sometimes the internet gods are just out to get us. That's all there is to it. There was a question about, I just wondered whether, from Jenny in the chat, just asking about how local authorities access the funding. And obviously this programme isn't open at the moment, but I wonder whether there was anything you could tell Jenny about sort of how the lottery normally funds things. But has anybody else, while Scott addresses that question, has anybody else got anything that they want to ask Scott?
Yeah, so thank you, Tina. Yeah, so specifically the strategic programs were launched under a specific umbrella of our strategic programs, near 600 million intervention over the 10 years. So because of the access to the data we needed for the evaluation and the connection with schools, then the Head Start program was specifically led through local authorities in conjunction with a significant partnership, and the bids were assessed on that basis and took, I think, over 12 months probably to get through the complete stages. So that was our strategic interventions. Whether we'll do them again, I'm unsure, but those were effectively a bit of a one-off, if you like, within our funding portfolio. So ordinarily now we have 3 strands if you want to look at National Lottery Community Funding. So the first one is our really light touch under £10,000, which is our awards for all. So all of this is on our website. It's really clear. You either click for under 10,000, over 10,000. If it's over 10,000, then you just need to decide what you want to do, what you want to apply for, and whether you're going to do that on your own as a singular organisation or through a partnership. So we're trying to do now, well, we are regionally based now, so all you have to do is put in your initial concept of an idea, because we're trying to make the work that you do to apply for our funding proportional now. So you put in an initial idea, which is a few pages long, and then one of our regional colleagues will contact you to see if it's something that the fund is looking to prioritise at the moment. If it is, then one of our regional colleagues will work with you to develop that application further to get an answer as and when's appropriate.
Thanks, Scott. We've also got a question from Brenda, and I think this might need a bit of a sort of a joint response, because I don't think it's just down to you to answer, Scott. But it's about how the Head Start sites fit in with sort of government initiatives and the other stuff that's going on around supporting children, young people with their mental health.
Yeah, so fundamentally, the Head Start programme was based on, as I say, the Test and Learn initiative. So it was to do things that statutory services may have been constrained through how they're funded or the guidance that they're given. So the Head Start programme was much more broader than that. NCB colleagues will speak for themselves as well, but one of the NCB roles was to advise and update us on changes in government policy and government direction, see how it fits in. So fundamentally, the Head Start programme had the flexibility, if you like, of that test and learn approach, but obviously working within the parameters that local authorities do. And
just to sort of pick up on what Scott was saying, I guess one of the things that we've been doing with the sites as they've been thinking about sustainability is looking at what the new initiatives are and helping them to sort of see what opportunities there are for aligning with them or using the initiatives to make the case for carried on for continuing the funding of certain aspects of what the Head Start sites have been doing. So it's and I'm sure that that will sort of be clearer after David and Daniela have spoken about what's going on in terms of their implementation. Anything you want to add, Pam?
Oh, sorry. Yeah, I was just going to add something. Thank you. So I've popped in the chat a link to the new hub on the NCB website, which is collating some of that learning that from the different sites, and one of the outputs from that is going to be looking particularly at those sites who have got learning that supports and can feed into some of the thinking around mental health support teams. So we will be working with the partnership sites specifically to draw out some of that learning that already exists and feed that back into via an output into the national programmes, particularly when we're thinking about all of those new sort of change in initiatives around sort of how the health system is going to be structured, and with a particular focus on that kind of partnership working, because that's the space that the partnership sites have sat in very comfortably over the past couple of years. So taking key aspects of the learning, and we'll be looking to continue to populate the new website over the coming weeks and months. So please do have a look there for those new outputs, and if people are interested in signing up to receive the outputs, if you can let us know after the event, and we'll make sure that you receive them.
So we do have another question, but I'm just aware that we've got David and Daniela waiting to speak, so we should probably move on. Now, for those of you who have found the applause button on Teams, then I do think you should take the opportunity to do what we would normally do if we were all together, and just say thank you very much to Scott. I know people have been saying that in the chat, but just thank you very much, Scott, for that overview and for coming along this afternoon.
Absolute pleasure. Many thanks.
So we've now got David Lockwood and Daniela Durso from NHS England and DFE respectively, and a really good sort of a timely point at which to be hearing from them about what's going on. Obviously, for those of us in the world of health, lots of change, moving to the integrated care systems, and just trying to work out what it is that we do at ICS, at place-based and at neighbourhood level. So I don't know whether you're going to be touching on that at all, David. But are you going first, or is Daniela going first?
First of all, hello everybody. Can I just check, is my audio okay? Because whenever I put my microphone on, I get an incredible amount of hiss back. I'm just making sure that you can actually hear me okay.
We can hear you absolutely fine. And now that I know that it is you going first, I'm not being very good at job titles today. So I should tell people what your job title is. So you are Deputy Head of Perinatal and Children and Young People's Mental Health at NHS England. So over to you, David. And you've got a slide, haven't you?
I've got a slide, yeah. So I think many of you may have seen me kind of do turns at previous meetings of this or similar events. I think you'd be glad to know that the intention today is not to tell you everything that NHS England has been doing since the inception of the long-term plan and beyond. Trying to give you a more brief update. I think Dan was going to say and try and get into the questions as much as possible. I'm not. It looks like there we go. So with that in mind, I think most of you are aware that there is a major section of the NHS England long-term plan around improving mental health support for children and young people with a number of commitments. I'm very happy to either take questions or share with you the detail on that. But a couple of things to mention today around some of the progress we've seen. I think in particular in the despite the ravages of the pandemic and how that's kind of really affected all our lives, but also flag some of the challenges that still remain that we are working on, particularly with our partners across organisations like Department for Education. So the main one, the main positive to pick up is that in terms of our main plan, which is to try to increase access to support for those children and people and their families that need it, we've continued to see progress in that. So the first bullet point there, you can see that the number of children and people has continued to increase. And to those that can read it, so there is a chart there. You may need to do the scrolling that Amanda said, but you can see that the blue line on the chart shows the access numbers of children that have been getting into the NHS for support. The grey and orange lines are our targets that we had in the 5-year forward view. So good news is that the investment that we've been prioritising and pushing for a long time is starting to have an effect in the actual, continued effect in the numbers, with a headline there of just at least 120,000 increase, even in just 2 years. Part of that, and particularly I think the uptick towards the end, is being driven by the programme around the mental health support team that's already got mentioned on here. So the headlines at the moment, we've got 183 of those teams that are now fully operational, which means that all the members of those teams have completed all their training and they're able to support children in those education settings. We've got 216 that are either in training or are just about to start. So basically they're paid for, will be commissioned, and they will definitely exist. And the final point in there, in terms of the numbers around the mental health support teams, some of you may remember from the Green Paper that where these originally stemmed from, the intention was to get to 20 to 25% of the country covered during the course of kind of this period. We're actually going to achieve that a year early, and our estimate is that we're going to get to around 35% of pupils covered by 2023. So good news there in terms of kind of the basic rollout. What I haven't got on there, but some of you may have noticed, the Department for Health and Social Care have been doing a commissioned an evaluation of the mental health support team. And Amanda, you jogged my memory where you talked earlier on about the need to focus on things like evaluation and evidence. An interim version of that has been published from the independent evaluation. I'll pop a link into this when I get a second into the chat, so if people haven't seen it, you'll get a chance to. Couple of sort of headlines from that were that there was overwhelming sort of agreement and positive response around the model and the sense of having an additional set of resource around mental health in education settings, and many of those responding to the evaluation felt that they appreciate things like the flexibility in there. So rather than this just be a purely clinical model that was being developed and introduced, the fact that it's there to support a whole school approach around mental health and wellbeing, wider than just doing clinical interventions, was very positively received, and also good feedback in terms of the pace and the speed at which the programme was rolled out. Some areas for further focus though. So I think there was from many of the sites that were interviewed, there was a continued concern around what happens with those children that perhaps have more complex need than the mental health support teams, which were designed to do predominantly early intervention and help. How do they? What's the answer for those children with more complex need? From Managed England's point of view, the quick answer on that is it's the growth of those existing services that sit around MHSTs that needs to happen at the same time to grow those capacity similar to those I was mentioning in that chart. But I'll come back to the challenge around that in a moment. Final thing I just want to pick up today that people may have questions on is over the summer there was a consultation that NHS England ran around bringing in further access and waiting time standards. So some of you may be familiar with, there are a number of these across sort of physical and mental health. For children and young people, there's already an existing standard around eating disorders, for example. But the proposal there is around having a more generic approach around all of children and young people's mental health, in that there should be access to support within 4 weeks from a referral. The consultation that has now closed. So if anybody's very interested in that as a topic and wants to feedback, we are still very much interested in people's views around how such a thing might be implemented, what risks and what benefits people might want to bring. So again, I'm happy to share some contact details, either take questions here, or people are very happy to have people feedback to me on that point. So that's the good stuff. That's the things where we think we've been some major progress. Challenges though, many of you will have seen that the Office for National Statistics and NHS Digital have been updating the prevalence estimates they have done for children and people's mental health throughout the pandemic. Headline there, we've seen a significant increase in need reported through that survey. So going from the 1 in 9, which was the last major survey in 2017, up to now 1 in 6 of sort of the 6 of those sort of school-age children having probable need. So going back to that, my first point around the increase in access, which is great. At the same time, we've seen that sort of huge increase in need there, which brings increasing challenge. And I'm sure all of you out there will know exactly what I'm talking about and how this is realised. How you actually feel in actual services and day-to-day interaction. It can often feel like, despite the progress that NHS England and colleagues will be reporting, often it feels like not enough is moving in a positive direction. I think largely because of that need carries on increasing. Another aspect, another challenge that we've got there is that we've seen some huge growth in workforce that's been able to deliver some of these benefits. It's something like a 24-25% increase, judging on the data we've got available, up to including 2018. But that only takes us to around 11,000 whole-time equivalent staff working on children's mental health in the NHS. If you think of that prevalence data I mentioned there, broadly speaking, you're talking of at least over a million children and people would be the sort of sum total of what that prevalence need would suggest. Those that that there's 1 in 6. So it gives you a sense of that gap that still remains between what we would like to be able to achieve and what and children and young people should rightfully expect, and how much further we've got to go. So despite all those challenges, it doesn't actually shift us from our main priority at the moment. And just kind of end this bit is that the long-term plan and those commitments, including the access, the rolling out of the mental health support teams, and the other things that we have got on our plate, continue to be a top priority. And we'll, our aim at the moment is to carry on delivering those as quickly and as effectively as possible. That's my update, Amanda.
Thank you so much. That's really great, David. I noticed we've got quite a lot of SENDIAS services here. I wonder whether you could just give us a sort of a very brief sentence, because I know that you do it, about sort of how you link across to the learning disability and autism team at NHS England.
Yeah, so there's a number of programs that we link up with both the LDA and SEND. I mean, there's alongside the commitment to grow access to mental health services, there's also a parallel one, which is around increasing the access to diagnosis and support for LDA and for SEND. So both within NHS England, my colleague over there, Sue Northwell, worked very closely with, and her team on a lot of this agenda. We're kind of represented and delivery partners on a lot of the work they're doing. So that includes the work around kind of reducing admission or having admission as a last resort, improving outcomes for children, people who are either neurodiverse or have SEND needs, and feeding into things like the Children's Services Review and SEND Review. So it's all part of a a joint piece of work. I know obviously with all colleagues from the Department for Education, who I can see one or two seem to be on the attending list of that, all part of that same conversation. So whereas the stuff that I tend to do is predominantly focused on the mental health element of it, there is of course that huge overlap, and many of the children and young people that will be relevant in my programs are also the same children and young people who are, the focus of the SEND programs and LDA and all the others.
Super, thank you so much, David. I think what our plan was to hear from Daniela briefly, who is the team leader for schools pupil mental wellbeing, and then perhaps if you want, if we ask for questions and you can field them together as appropriate, if that's all right. Welcome, Daniela, and I think you haven't got any slides, but you're going to say some stuff.
I am, and I will try and keep it brief. As David said, I know that a lot of the value that the people get from having us along to do the government updates is the chance to speak to us rather than just being spoken at. So I will try and keep it as brief as I possibly can. So I just wanted to update you a bit on kind of the work that my team has been focused on since the start of this year, which has largely been around kind of COVID recovery and kind of supporting the education sector through all the disruption that's been faced over the last year, which is probably unsurprising. So my team has led the Mental Health and Education Action Group. That's been quite a lot of engagement across various different groups across health and education. The aim of that really was to look at the challenges that education settings were facing in the moment. So we did recognise that people probably at the start of this year in particular weren't really thinking about their longer term strategic approach to mental health. It was very much when settings were reopened to the majority of pupils, just trying to deal with the issues that they were facing and the things that had been experienced throughout the pandemic. So a lot of the actions that came out of that had a very short-term focus. We've done a lot of things like signposting to the existing support and information that's already out there. We developed some lesson packs for the new RSHE curriculum to help settings to think about how they can kind of introduce some of the issues that children and young people are concerned about at this time through the curriculum, to start kind of normalising it and to show that kind of other people are feeling that way and that's okay, and that you can seek support if you need to. We worked with our mental health ambassador, Dr. Alex, to produce some videos that were available over the summer that again were kind of in the promotion, kind of how to look after your own wellbeing type thing, and we made sure that they were available in holiday activities and food providers as well as summer schools. One of the really early kind of key successes from the action group was that we fed into the Wellbeing for Education Recovery programme. So that followed the Wellbeing for Education Return programme last year, which provided training and support and resources to local authorities for them to make available to the schools and colleges in their area. One of the things that came out really strongly throughout all of the meetings that we had with the action group was about the importance of local support, and that schools and colleges know what is available to them locally and how they can access that. There's only so much that we can do at the national level. So we were able to feed in a lot of that expertise and kind of guidance into the packs that went out with the Wellbeing for Education Recovery funding. With the group, we've also kind of got some longer term actions. I mean, we recognise that it's a long term challenge, and even with the things that we've done quickly, they're not kind of fixes, they're the start of a journey rather than the end of it. So we're looking in the longer term at updating our existing counselling guidance, and as part of that, again, something that's come out really strongly is the benefits that kind of remote and digital counselling have had for some people. Some people find it more effective. It can kind of give you flexibility and reduce the waiting times. So we're really keen to kind of incorporate that into the guidance and make sure that that's, you know, schools know how to balance that remote versus face-to-face, and that one doesn't replace the other, because, you know, they're both useful and both have their place. Also thinking about how we can help settings use the funding that they have available to them most effectively, and that's really about kind of understanding the needs of their pupils and students, and understanding kind of what sorts of support are most appropriate, and kind of giving them that confidence to work with the evidence. And then again, looking at children and young people's voice. So as Scott was saying earlier, we know that we don't want it to feel like something that we're doing to children and young people. We want them to have a say in this and to kind of feel that their voices are being heard. So we're in the process now, working with NCB and the coalition, to set up some sessions with children and young people, really to focus in on kind of how they would like to work with their settings to make sure that their voice is being heard. And then we'll look at producing an output based on kind of how those sessions go that we can share with schools and colleges to kind of help them to think about that in their whole school approach. So as I said, kind of this has all been very short-term focus. What do we do just to get through to the kind of end of last academic year and into this year? What we're doing now is kind of thinking about how we can take all that good work from the group and really look to the future and think about how we can kind of make sure that that's really embedded in the longer term strategic approach that David's touched on earlier, the kind of the green paper and some of the other longer term work that's going on across the department. I mean, so the key part of that really is the senior mental health leads training. So I think hopefully people are aware. Last month we invited schools and colleges to start booking the quality assured training. We've got over 65 courses available for senior mental health leads, and an online tools that they can use to kind of assess their learning needs and based on their current level of knowledge, so that can be more tailored and targeted. So we know that not everyone is starting from the same place and not everyone will have the same sorts of needs. So it's really up to the schools to kind of think, and colleges to think about what sort of training their lead needs, and that they can tailor that appropriately. I mean, and we've had really, really good success with that so far. We've had around 4,700 schools already kind of taking up the offer for the grants, out of a total of 7,800 that's available to them. I mean, so that's a really good success and something that we're really keen to build on, especially in terms of kind of how well the messaging seems to be landing in schools and colleges, because I think that's something that we have struggled with in the past. We are doing lots of work in this space, and it does sometimes come back to us that people don't know what's going on. So I think there's lessons for us here about kind of how we get that information out there. We're also thinking about how we can support senior leads once they've done their training. So looking at all the resources that we've published through the action group, kind of how do we make sure that senior leads know about them, that they're able to access them easily. But we're also kind of thinking more broadly than that. So my team also has responsibility for anti-bullying policy. We are shortly going to announce the successful bidders for our new anti-bullying grant programme who will be delivering anti-bullying support to schools. And again, we want to think about how we can help senior leads to link up with the information about how to access those grants or other support, so things like behaviour hubs, you know, wider things that are going on, making sure that they've got a really strong RSHE curriculum. We're working very closely with behaviour colleagues and attendance colleagues at the moment as well. So we know that behaviour team are doing a lot of work around updating their guidance and updating the exclusions guidance. And we want to be really sure that we're using consistent language across both teams about kind of having a behaviour approach that meets the needs of users in the setting, including those with mental health difficulties, and that you can have kind of a good behaviour policy that doesn't come at the expense of those with mental health needs. And thinking about kind of how we can support schools with attendance. I think we're hearing anecdotally quite a lot that that's a big challenge at the moment. So we want to make sure that kind of the people who are looking at attendance in schools know about the resources and support available to them, as well as the senior leads, and that kind of the right people are getting the information that they need. David's already mentioned mental health support teams, so I won't go into that, obviously, but we are also thinking about kind of how the work we're doing within DFE is giving settings kind of the right knowledge and support to identify issues and put support in place. So either for schools working with mental health support teams, but also those without. So, you know, they're able to identify pupils who might have issues, but they also know what the right type of support is and how they can access that. So I've mentioned our counselling guidance, and we're also looking at how we can promote our mental health and behaviour guidance that kind of talks about identifying issues and understanding what's underlying kind of causes of behaviour. And then the other kind of big area to touch on, but not one that I'm a massive expert in, is the upcoming SEND review, which we'll be very closely linked into again, and I know that's an area of interest here. So the SEND review is going to look at kind of what is needed to make sure the right support is there for children with special educational needs, and from our perspective, that really includes ensuring that settings again know what their pupils' needs are and know what the right sort of support is. And you know, you'd go through the same process to identify kind of what the needs are and what the support is, whether or not that child ends up having a special educational need or any other need that might need additional support. So it's really important that we're really consistent and joined up, and that support is available. So that was a real whistle stop there, but I definitely wanted to leave time for questions.
That's great. Thank you very much, Daniela. And absolutely, it was interesting. Actually, heard a presentation from somebody who's been doing some research into sort of integration and what ICSs are focusing on, and apparently mental health is their #1 priority. Children's mental health. In this is about the children's space, not all ages. And the second thing that they're focusing on is SEND. And I think actually, you know, the crossovers between those two things are so very significant. And obviously, we know a lot about co-occurring conditions, which brings me on very neatly. Anyone would think that I was used to chairing things. To Linda's first question. So Linda, do you want to actually appear and ask it, or would you prefer me to?
Happy to. We're just seeing this huge increase in children and young people with additional needs and disabilities. There seems to be, if they are offered mental health support, that actually the professionals haven't perhaps necessarily got that understanding on what is the right approach in which to be able to support them. So children are actually having a sensory overload due to the format of the session with another adult. For a lot of our young children, actually verbalizing and communicating what those triggers are to them having what is seen as a meltdown. In some cases, if there are sensory adjustments made, the anxiety can be reduced, so it doesn't even need to be followed up as mental health issue. We're seeing an awful lot of girls who are ending up in some cases hospitalized due to crisis, because what is actually happening is they're undiagnosed autistic, or we're also on the other side of that having lots of children who are autistic being told it's just their autism, and therefore they're not having that separate mental health support. And as a parent carer forum trying to support our families, parents themselves are not included in the same way for mental health support in the actual process, in how that support looks, and expecting the child to be able to say what's happening when actually parents are noticing different triggers to that would normally be encountered due to their SEND needs. Hopefully I've made sense in how I've explained that.
Thank you, Linda. That's quite the cocktail there. But I would, it does chime in. We've just done some the Northwest, and one of the things that came out very strongly there from the parents that we talked to was even if there was the availability of support for the child or young person, actually that there very rarely was, or in fact there never was for the parent in terms of helping them to sort of to manage the situation. Anyway, enough from me. David, and I think probably particularly David, that was aimed at you.
Yeah, thank you, Linda. So I agree and recognise that the issues that you're describing there, and all too frequently have been the experience, I think, for too many families. I think in terms of just to kind of say what's happening, so there is. There has been training for around some of the issues around this, in particular colleagues at Health Education England, lead a programme doing some of the modules from around the CMIPI Apt programme, if you remember that. Particular elements around things like neurodiverse need. I know this is slightly different. However, I know that Health Education England are reviewing some of the, a lot of those trainings. So I can't give you the answer yet as to what that will come out with, but it is something that is being reviewed at the moment. But I think what I'd also add to that, I think I get a really strong sense of this is there's a set of issues here that have been gripped quite fully by local systems and themselves. So there's an awful lot of what I see through our things like clinical networks that are actually people who are coming and sharing learning and their experience with their peers around this. So I had a very powerful presentation, which was from someone who was I think it was lived experience around SEND, who was actually saying the things that made their experience kind of very poor versus much improved as examples that then you are getting clinical leads taking back into their services. So I think it's both those things from our perspective at what we need to kind of make sure are pushed as hard as possible. I think realistic, there is still a capacity point on this, unfortunately. It goes back to some of that part. And I think the point, Amanda, you said about parents as well. I think it's particularly pronounced there. I think there are a few professionals working in this area. Often, the priority historically would be around the child, and sometimes the family and the support around parents and carers has been the thing that has still continues to struggle. My expectation and hope, whatever, is that will continue to improve. I think there will be recognition. It takes time, but I think I am heartened by the fact that that there is this is something that is actually being pushed, but not by people like myself, for instance. Telling people to do this is actually coming up from services themselves who actually want to do much more appropriate a job of kind of supporting people. So it might be one that we come back to with our colleagues from over time in forums like this with our colleagues from the SEND team as well, because I'm sure we'll have it'd be a good joint conversation to have maybe.
And any training offered to parents themselves so that they could actually support their children and notice and help themselves. That would be incredibly helpful, as they're the constant. They're always with their children.
Yeah.
Thanks, Linda. And one of the things that we've raised with NHS England is actually dynamic support registers. Unless they take a account of family context, then they're not actually really understanding the level of risk for that child in terms of admission. But I'm going to give David a wee break, and I've got a question here from Kate for Daniela about the whole school approach. Kate, did you want to come in? I'm going to ask it because it will speak, because we haven't got. Oh no, you're there, Kate. Go on.
Sorry, I didn't. Sorry, I didn't twig it was me. Daniela, I was just thinking, as you were talking about behaviour links and behaviour policies, it would be fantastic in that new guidance to hear more about relational approaches, rather than the traditional behavioural approach that seems to be coming out of Tom Bennis and co.
Yeah, I mean, so the guidance is in the process of being updated, and I don't know how much has been said externally about timescales, so I need to be careful about what I say here. So I know that when there is a draft, it will be shared, and I believe there'll be a consultation, so people will have that opportunity to kind of comment and see if it feels like it's in the right sort of space. But what I can say at this stage is that but my team has been working really closely with them to kind of try and strike that balance a bit better, and colleagues in the special educational needs team have also been involved, and the team have been really open to kind of working with us and taking some of that that sort of things on board. So I think once there's more information about kind of what the process will be for updating the guidance and giving people the opportunity to comment, then we're really happy to share that information through NCB so they can share that with this group and make sure that people, a wide range of people, do have that opportunity to comment on it. But it is something that that the behaviour team are kind of aware of, that that they need to strike a better balance, and something that they do seem open to.
Brilliant, thank you. Thank you for sharing.
I also saw, sorry, that you had a question in there about the whole school approach, about the consultation that we're talking about with young people. And so my team is, I say relatively small. The people I have working on that is relatively small. We need to try and keep it proportionate, but we are really keen to engage as many people as we can. So we're trying to set up a few kind of small sessions that we lead, and then potentially looking to work with other kind of groups of young people that are already established to kind of go to one of their meetings, or to get them to kind of run through the same sorts of questions. So if you want to drop me a line outside of this, I can give you some more information, because we are really keen to not overwhelm ourselves, but to engage as much as we can. So yeah, I'd be really happy to take that offline with you.
Thank you, appreciate that. Cheers. Thanks, Daniela.
Thanks, Daniela. Pam, have you popped up because you need to tell me to do something?
No, I was just trying to look more inclusive. My screen was looking a bit blank there, so I thought I would.
I'd forgotten something.
No.
Robert Wilson, would you like to come in next? You've got a couple of questions for David.
Yes, thank you very much. Hopefully my mic's now on. First, well, two questions. The first one is, what will be the link with schools' mental health champions? Recognising the fact from the previous slides, the help needs to go in as early as possible to stop the escalation. For many schools, because they don't see a problem behaviour, they say that there's nothing for them to do. The behaviour comes out at home. And that happens quite early on in the child having difficulties, and it continues to escalate, and they may become school refusers. So anything that can be done to support schools to recognise need, even though they don't see it, but also to meet need that is being demonstrated has got to be a win. The second question. Sorry, pardon me. Sorry, do you want to answer the first one? Do the first one, and then I'll do the second one.
Thanks, Robert. Yeah, could you just check the mental health school champions? What exactly? Because it's a term that I'm kind of familiar with in different contexts, and I'm just making sure that we're talking about the same thing, whether that's the senior mental health leads that DFE are leading, or if it's something else.
Schools are being encouraged to have a mental health champion, and the DFE is rolling out training.
So I think that's a mental health lead, yeah. So but so that particular program, intrinsic part of what we're proposing through the green paper, what will happen is when you have, I mean, in many places the leads already exist is the first point. What's happening now is training that will boost the competence and capacity of those leads where they are in situ. But what should be happening in each of those settings where there's an MHST involved is that there should be a conversation between the two. So the MHST should be there to support the whole school approach, which is led by the school and the school staff, of which the senior mental health lead will be playing an absolutely vital part. Their approach needs to be more than just, as you say, the children who will benefit from particular interventions within the MHST. So what we're expecting, what we're trying to promote with this is, the school itself kind of saying, this is how we're going to support our staff. We know what support we can draw on from the mental health support team, from more specialised services, from sector, from whoever. But that's always been the intention of how it will act. It's actually happened on the ground sort of before, to some extent, the training managed to get, the national training managed to roll out, but that will be augmenting that. I would just say, I asked a question about who we're talking about. I think the same principle would apply from my perspective from MHSTs, that they should be working with anybody who's working within that education setting who has a role to play. So the mental health lead will be one with the key elements, but should also be working with, if there are other people who are active, it could be the school nurse, it could be whoever else, but it should be part of a conversation that would continue throughout their involvement in that school. So that's a key fundamental point, is that, and it's one of the things about, when I said at the start, it's not just about us creating a service that will parachute in and do some intervention and disappear. It's about them being part of the fabric of the school and being really in there and visible. So I think it's all part of that function.
So Robert, since you're a bit cheeky with your second question, can I ask you to be double quick with it?
Yes, we hear infrequently of children that aren't supported because they won't go into the CAMH setting, and therefore CAMH close the case. Quite often they won't leave the house full stop. So asking them to come in. What's going to be done about that small but quite worrying group?
I think there's two elements to this potentially, Robert. So, and it's always the difficulty of commenting on examples like that without knowing the ins and outs. But in terms of principle, if I can take it like that, there should be no barrier to children accessing appropriate support in the nature you just described. It should be a case of that what we want is to have services that have got an open and blended offer between different ways of accessing. I think one of the few positives that we've seen coming out of the pandemic is the number of services that have managed to really enhance and expand things like their online, their virtual offer of support. One is, as I think Daniela said earlier on, one doesn't replace the other, but it's something that I think more and more people and children, people and families are looking to expect to see to be delivered and to be available to them. I know there are instances where there are particular challenges around, individuals may be accessing and they might have particular challenges, and it might be the case of, just opening an online function will not be quite what they need, but I would still be expecting those services to be working with those families to try and find an appropriate solution. Yeah, I think it's one of these things as well that we'll again, I hope and expect will continue to improve as things like technology improves, and as the practice that in many services that are already managing to embed and roll out can be shared. But I think also a really important point, as you're doing now, highlighting where those things do exist and pointing out where they are unacceptable is another way that will help and drive that change.
Thank you
Thanks
both for
very
helpful
much.
answers, and sorry for my cheeky second question.
We'll let you off. We'll let you off, Robbie, because it was a good one. And just to sort of say that one of the things that NHS England has funded is some training on dynamic support registers and CTRs for SENDIAS services, and we'll be doing some more work with SENDIAS services to make sure they're up to skill. Because one of the really important things is us making sure that those young people where they have learning disability and autism make it onto the dynamic support register, because often that is the case. Daniela, I'm going to come to you for what I think will have to be the last question. But Charlotte, Charlotte Hill, do you want to come in and ask your question about trauma-informed approaches? Charlotte's either gone very shy or she can't find the mute button.
I think she may have gone into our workshop because it's just opened up.
Marvellous. Right. Well, I
was just about to move over in a panic.
I'll ask Charlotte's question, which is how much attention is being given to trauma and adversity-informed approaches as part of behaviour policy development, please?
I mean, I think my answer for that would be quite similar to the previous question. It's in the early stages, and it's something that we're feeding into. I think we touch on it in our mental health and behaviour guidance that we published in my team a few years ago. So what we are trying to do is make sure that the links between our guidance and that guidance are much clearer, and that they're very consistent with each other. I don't know how successful we'll be in kind of how far we can push it with that, but as I say, it's something that we'll make sure that people have a chance to comment on when that opportunity comes up, because I know it's something that comes up very regularly.
Thank you so much. I'm very aware that I didn't get to half of the questions, so I'm going to be really cheeky now. David and Daniela, if we sent them to you, is there any way that you'd have time to have a look and send some answers back to the questions that we haven't managed to get to?
Yeah, do our best. Can't promise you how quickly it will be.
No,
I can see there's quite a few on there, but yes.
I completely understand, and I also understand you've got other things to do apart from very kindly coming along to speak at our events. But yeah. And some of them actually, Pam, we may be able to answer anyway. So let's make sure we only send David and Daniela the ones that we don't know the answers to. That might help a bit as well. So can I get everybody to do the applause again? Thank you so much, David and Daniela, for giving up time. I know how busy you are, and really appreciate you coming along and updating people and reassuring us that that things are still on track.
Thank you.
No problem. Thanks for having us.
So just a quick recap about workshops. You should all have had 2 invitations, and so it sounds as though your workshop leads have disappeared ahead of time to make sure that they're all ready for you. You have got a quick break. I'm just referring to my well, in fact, I'm sorry, we've overrun, so you've now only got 2 minutes, but you have got a 2-minute break before workshop 1 starts. But just to keep you going, you do have a whole 10 minutes in between workshop 1 and workshop 2. So any problems, stay. If you find, we'll get somebody to stay in this session. So if you have any difficulties getting into your workshop, or you've suddenly realised that you haven't got an invite, then come back in here and you can let us know, and somebody will hopefully be able to sort it out. But in the meantime, thank you all very much for coming. We know things are incredibly busy for everybody at the moment, so it's just brilliant that so many of you have come along, and a testament to your commitment and the fact that you just always want to improve things for children and young people. So thank you all for coming along, and hope you really, really enjoy the workshops. Anything else to say, Pam, or should we let them go?
Sorry, can I just say there are some links that have been pasted into the workshop. So if you haven't received a link already, or for whatever reason it's been duplicated, you need to swap, those links are available to click on one and go into a workshop now. Thank you.
Thanks, John. I'm not sure I completely understood that, but I refer you to my earlier offer, which is if you find yourself stranded and not in a workshop, then come back in here and we'll try and sort you out. Off you go.